Hi, everyone. Thank you for attending our webinar. I'm really excited that everyone came. My name is Katie Verb, and I am new to HSA. I joined about 2 months ago, and I am managing the Blood Sisterhood program. If everyone could mute your lines, whether you're using your audio on the phone or on the computer, that would be really helpful so we don't get any feedback. Also, if you have any questions, questions can be submitted through the question box, and after the presentation, I will read them out, and Anne-Marie or Vicki can answer them. The presentation tonight is going to be from the Foundation for Women and Girls with Bleeding Disorders, which is a nonprofit 501c3 organization that was launched to serve as a single site, single source, where physicians and healthcare providers can obtain information. Anne-Marie Nazaro, PhD, is the Executive Director of the Foundation, which focuses on educating providers and changing women's lives. Anne-Marie has 23 years of leadership experience in the nonprofit or NGO sector. For 12 of these years, she served as a Director of Vice President for Education at the National Hemophilia Foundation, where she inaugurated and helped develop the first U.S. awareness campaign for bleeding disorders in women, Project Red Flag. Another other panelist, presenter, Vicki Jacobs-Pratt, MSN PMG, has been the operations manager for the foundation since its inception. As a woman with type 3 von Willebrand's disease, she brings not only her personal bleeding experiences, but her accounting and nonprofit management training, and over 12 years of volunteer and staff experience in developing and managing programs in women's bleeding disorders, nationally and regionally in New England. So with all that, I look forward to a really great presentation, and I'm going to hand it over to Anne-Marie.
Good evening, everyone, and thank you so much for joining us. And I particularly want to thank inviting us to present this webinar this evening. And I want to say that it's a delight for me to be able to do this tonight with my colleague, Vicki Jacobs-Pratt, who's been with me on the project of establishing this foundation from the inception and before that, when it was simply an idea. The mission of our foundation is to ensure that all women and adolescent girls with blood disorders are correctly diagnosed and optimally treated and managed at every life stage. How our founding mothers, actually, we call them founding mothers only colloquially or around the house, so to speak. We had 3 renowned physicians, all of them women, who came up with the idea that there was a critical need for a foundation for women and girls with blood disorders that would do a very important thing that they observed was missing. And Vicki is going to tell us a bit about this niche that our founding board members saw a need to fill.
As a patient and a volunteer for several nonprofit organizations that I had been working with at the time, I too had seen the niche that was not being addressed with the community health care provider. And so I was very excited to be a part of this new organization which stresses that education and how important it is that the family practice providers at least understand about blood disorders and where to go to find information about something that they don't see on a daily basis. So our organization, the Foundation for Women and Girls with Blood Disorders, is dedicated to educating those key healthcare providers in the community about the consequences and effects of blood disorders at every life stage. And this is a whole long list of community healthcare physicians, such as family practice providers that I've mentioned, pediatricians, internal medicines, OBGYNs, the hematologists and oncologists, and maybe the community physicians that don't work in the bleeding disorder community all the time, so they don't see the uniqueness that a woman or girl might have with a blood disorder, as well as the hematologist who has the bulk of his practice in oncology or cancer and may not know the things so well as the folks that we know at our local hemophilia treatment centers. And we go through a whole life stage, including geriatricians. And one important piece of the foundation is really to reach out to the frontline physician that sees the patient maybe for the first time, like an emergency department that would see the patient for the first time and not really know how to treat that patient with their unique blood disorder, as well as the nurses and social workers that are out there. And I'm very excited to be a part of this because it's a direct benefit to me as a person with a blood disorder to have a resource that I can talk to my doctor about, or say if you have a question about this, you can go to this website. And our other major mission is to translate and disseminate information and research to providers, therefore benefiting the women and girls that they treat.
We thought now we would introduce you to, and some of you in the audience will actually know some of the women we're going to speak about here. These are our current board members, and they include the 3 founders of our Foundation for Women and Girls with Blood Disorders. Dr. Andra James, known as Andy, was formerly at Duke University and has worked, she's an unusual OBGYN insofar as having worked at the intersection of hematology and obstetrics gynecology. She saw early in her training at UNC, University of North Carolina, Chapel Hill, where they have a very strong hematology department, and a lot of the important work in hemophilia and bleeding disorders had been done historically at UNC. Andy trained there, and though she wanted to go on the OBGYN track, she really got it that there's an intersection of hematology and obstetrics gynecology. And this is part of this background, this important training, told Andy that when she looked across her peers and other physicians and all of those different disciplines that Vicki just talked about, Andy decided they don't really get enough of that training. And that's how this idea crystallized for Andy James, along with Barb Conkle, Dr. Barbara Conkle, formerly at University of Pennsylvania, now at University of Washington, Seattle, and Roshni Kulkarni, very well known in the bleeding disorders community, as all of these women are, and men. We have Ken Mann on the board as well. But these 3 founding women, founding physicians for our organization, they are particularly tuned in to this need to educate their peers. Roshni was the head of the Blood Disorders Division at the CDC, and of course she's been a professor for a long time at Michigan State University. So those were the 3 who catalyzed this foundation. They had the idea. They brought in myself and Vicki to get going on it and to get it seeded. And along with them in the early days was Lynetta Jordan, a renowned sickle cell disease advocate and physician, and Jen Dietrich, who's a gynecologist at Baylor. And Jen has been invaluable in informing the work we do in the area of adolescent and pediatric gynecology, which is so important because we want early diagnosis and correct diagnosis, and not these long years of waiting to diagnose women with bleeding disorders and other blood disorders. Evelyn Lockhart, and I've said Ken Mann already, I mentioned. Ken is very distinguished in the science of hematology and has been the newest board member and a great asset to our work. Leslie Graham was recommended to us through NHLBI, the National Heart, Lung, and Blood Institute, and physicians we work with there, and she's been very, very strong in the treasurer position. So that's an introduction to our current board. Now, the why. So here I think we're talking about why when we say our founders saw the need to educate their peers. Well, why do they want to educate them and feel strongly, why do they feel so strongly about the need for our foundation? Because of the unique issues for women and girls at every life stage. And Andy James has put together a couple of charts for us here that I'd like to take you through for a couple of minutes. In these charts, we show each life stage for women and girls, and we look at, on the right side of the chart, we look at the issues that women with blood disorders and girls with blood disorders have in those specific life stages. And what we've done is, in red, you see the ones that affect a lot of women who might be listening in the audience tonight or have family members who are affected in this way and have bleeding disorders. The red shows the manifestations, the complications or difficulties when you have a bleeding disorder. The purple would indicate women who clot too much and some of the things they might run up against. So you can see in adolescence just the anticipation of menses, and if you know there's a bleeding disorder in the family, there is some anxiety that could come with that. And menorrhagia, of course, heavy menstrual bleeding is one of the strong and typical possibilities and probabilities. The ovarian cyst, endometriosis, and there are risks and benefits that have to be weighed for women with bleeding and women with clotting disorders when they come to the consideration of contraception. In preconception, in that early reproductive life stage along with menses, and when you're thinking about the idea of having a family, then genetic counseling, so you understand the root and what goes on in a bleeding disorder or a clotting disorder that is genetic. And then risks to the mother and pregnancy, whether you're clotting too much or you're bleeding too much. We know you want to think about and understand fully the risks before you head into pregnancy, just so you're apprised, informed, and you have the right team giving you care when you make that decision for pregnancy, the next life stage that we look at. We know risk of bleeding goes down, but risk of clotting, thrombosis, elevates. We know platelet counts go down, and that's another risk of bleeding. Hemoglobin is low, and the risk for anemia. And then in the sickle cell area, another disorder that we're concerned about, there are increased frequency of crises at the pregnancy stage. In childbirth, we know about anesthesia being a risk for women with and girls with blood disorders. Well, we'll say women and hoping that we're waiting for womanhood birth to children. We have issues of postpartum hemorrhage, and we know that's a very strong one. When von Willebrand factor is elevating during pregnancy, we're not so worried in the pregnancy phase about bleeding, for even with women with von Willebrand disease. However, after delivering the child, there is an increased risk of postpartum hemorrhage when the factors go to their usual level. Postpartum, again, that delayed hemorrhage in women with bleeding disorders, and women who have coagulation, excessive clotting, they have risk of thrombosis of a clot that can be life-threatening. Perimenopause, we worry in the menopausal phase for women with bleeding disorders. We see, and Dr. James, Andy James, has documented this in her research and in studies, where fibroids, polyps, endometrial hyperplasia, the thickening of the uterine lining, those are risky issues that occur for women with bleeding disorders. We have to discuss and we have to think about carefully when you have a clotting disorder or a bleeding disorder, the issues and risks in hormone replacement. And then, of course, any surgical procedure at most of these life stages or all of these life stages when you have a bleeding disorder, surgical procedures have to be planned for and proper prophylaxis. So knowing that all of these issues are going to present a problem for women and girls with bleeding disorders and clotting and other disorders, we know the problem situations And now we know that we need to do education, and we want to reach providers so we can get earlier and correct diagnosis and proper treatment and management. But then the question was, as we started the foundation, how? What are the tactics? What are the strategies? How will we do effective education? And we came up with 4 core strategies or tactics, and we also want to work on getting the word out through our PR firm that we get pro bono services from, actually. And we had worked with an ad agency to do our logo and get our design for our website. But the 4 core tactics were medical society meetings, the major national medical society meetings across the country, a state-of-the-art website, fwgbd.org is our URL. Please take a look at us, and we'll be saying that again to you throughout this presentation. Webinars by the top experts. We give CME, Continuing Medical Education Accreditation. We are looking into now CEUs for our nurses and social workers, and we use Duke University for our accreditation. We are very, very interested in medical curriculum development. We want to enrich the medical curricula across the country so that doctors and medical students are learning early and thoroughly in their curriculum about bleeding disorders and other blood disorders in women and girls. So we're very keen on that 4th tactic. Now, you might ask, how do we think we have the audacity to do major medical society meetings and bring education of excellence through our meetings and our webinars? And I want to just introduce you now to our Medical Advisory Committee. And don't get too concerned. We have 22 members, and I'm not going to give you every single name in this talk tonight, but I do want to highlight for you some of the reason and the people we've attached to our foundation. They are the reasons that we believe we can be successful in influencing medical curricula and in delivering education of excellence. If you look on this, Vern Katz is an OBGYN, so he might not be very well known to this community, but he happens to be the editor of the leading gynecology textbook used in the United States. So with somebody like Vern on our team, we have the boldness to say, yes, we can influence the medical curricula in this country and get it informed by the issues that affect women and girls who have bleeding and other blood disorders. Terry Gernsheimer at University of Washington is the leading platelet woman or researcher and clinician in the world, I would say, not just the country. We have Jim Bussell, who's known in our bleeding disorders community at Weill Cornell Medical Center. On the next slide, many of these don't need an introduction to the bleeding disorders community and HFA members. Peter Koides at University of Rochester, a leading hematologist who's done a significant amount of work in the area of women's bleeding disorders. And he's a very interesting and kindly and dedicated hematologist. He's one of the few men you know who's based a lot of his career on measuring the blood output in a woman's tampon and Kotex, because he's very concerned about understanding the heavy bleeding and the issues of heavy menstrual bleeding for us in this audience and for those of us, Vicki and others, dealing with von Willebrand disease and other bleeding disorders for which menorrhagia, heavy menstrual bleeding, is one of the complications. Marilyn Manco Johnson at University of Colorado has done some of the cutting edge, the leading research in the area of hemophilia and women's bleeding disorders and thrombophilia as well. Diane Nugent is a well-known name in California. We have Claire Phillip here in New Jersey, where I'm speaking from, at Robert Wood Johnson. And Claire worked with CDC to develop one of the finest and earliest screening tools, 8 questions that a doctor can use in her or his office to ascertain if a woman is at risk for having an underlying bleeding disorder and to send her on for further testing. Maggie Ragney is just a dynamo doing incredible work at University of Pittsburgh and at her treatment center, Hemophilia Center of Western Pennsylvania. All of these are connected to us on our medical advisory committee and have worked for us in significant ways through medical symposia, webinars, articles that we write for journals, so the word is getting out pervasively. From this list, I want to point out that we are committed to going across disciplines. We know how to speak to hematologists. We're really good with Andy James on the team and Jen Dietrich. We can get to OBGYNs, but we have made sure that our medical advisory committee includes the former president of the American College of Emergency Physicians, Sandra Schneider, who is helping us get into that provider group so that emergency physicians will not be deer in the headlights when one of us shows up at their emergency room and they're baffled, why are we bleeding so much, or why is this or that going on? We want to train them and educate them so they have the tools to recognize the woman with a bleeding disorder when they need one. We also have Barbara Yawn in family practice, a leading family practice physician who works on NIH expert panels and who is helping us infiltrate, I'll use that unabashedly, infiltrate the family practice discipline. So that's our introduction to some of our medical advisors. The medical meetings we attend, I want to just give you kind of a snapshot in a couple of slides. These are the presentations, the symposia, the workshops that we've done at leading medical meetings. We've been at ASH 2011 and 12, and we've been accepted. We're doing a 4-hour symposium in this year's ASH in December. Society for Maternal Fetal Medicine, very important for reaching that group of OBGYNs. The Sickle Cell Disease Research and Educational Symposium, because that's an important group of women and girls who are underserved, and their physicians, our physicians who do sickle cell, need the information. We work very closely with CDC, as does our partner HFA. Other medical society meetings, Thrombosis and Hemostasis Summit of North America, that's a new meeting that started in 2012. We are one of the founding partner organizations for FISNA, as it's affectionately called. I want to just say in summary that in 17 months with our team, whose names I've discussed with you on our board and in our medical advisory committee, with our team we've been able to do 12 major symposia and workshops just in 17 months. And that's in addition to 4 webinars and writing articles. So we are very indebted to this team with our foundation. In the medical society meetings, I just want to point out that we don't simply go to the meetings and deliver education. What we do is measure if we've changed the knowledge of the participants attending our symposia. And at the first ASH, our premier symposium at ASH, Gynecologic Challenges for Hematologists, what we did was we gave a pre-test to almost half of the attendees. 101 took the pre-test and then the post-test at the end of the 4 hours. And their scores went up on average 51 percentage points. That's from pre to post-test. The learnings were very significant at the less than 0.001 level. So we are intent on doing the education and then measuring the outcome, measuring if we hit the mark. Here are some other ways that we look at. We want to know if what we're teaching will result in a change in practice behavior among the physicians we're reaching. And in it is true that what I've learned in these 4 hours will change my practice behavior vis-a-vis women and girls with blood disorders. I left this slide in just to point out that sometimes we take advantage of a medical symposium where we're doing education to honor women along our way who have helped us to understand the needs of women and girls with blood disorders and helped us build the campaigns like Project Red Flag, the new organization like Foundation for Women and Girls with Blood Disorders. And one such woman is Anna DeSimone, whose name I hope is familiar to some in the audience. Anna worked her entire life, and unfortunately we lost Anna in April 2012. But in 2013, we memorialized her and paid tribute to her with a workshop at the North American Society for Pediatric and Adolescent Gynecology, where we reached 400 of these young physicians seeing women and girls at the critical stage when they could be effectively diagnosed. And we know that was a fitting and important tribute to Anna DeSimone. I'm going to now have Vicki, and you'll be happy for a change in voice. Vicki will now take us through our website. Another, as we mentioned earlier, the second important tactic or strategy that we use is a state-of-the-art website. Vicki?
Yes, Anne-Marie, thank you. Our website is what we feel is cutting edge, and of course we love it. But it is clearly focuses on the provider and how the provider can learn from what we have in our repertoire of information about women and girls with blood disorders. You can see on the home page here that we have some animations on our website, we have our vision, and then we have some areas that shows our upcoming webinar that will be coming up in November, coming events where we're going to be, or where other important things are happening. And on the right we have news and things that are going on that has changed quite frequently. But what I wanted to mention was down at the bottom of the screen there is a for patients section. About halfway down in the middle of that gray bar, patients can click on that button, and we have gotten feedback and are currently looking at changing that button and making it more obvious for the patients who do come onto our website that may not understand that we're there for educating providers and changing lives. But we do have this for patients section that patients can find out what they can do to help us get the word out. And it goes through the things that we've been talking about this evening, as well as a list of patient resource organizations that the patient can go to for all of the different support services, such as Hemophilia Federation of America and Cooley's Anemia Foundation. And these are patient-centered organizations that provide patient support, education, networking, and awareness. As I'm sure if you're involved with HFA, it's wonderful to get together with other people that have the same concerns and issues that you have. I know it was eye-opening for me when I went to my first patient support meeting and found out that I wasn't alone. But if you go to the top of the website, we have some other buttons along the bar there that has a newsroom and resource. Under resources, I wanted to point out a very interesting section in our library. And we do have a library of peer-reviewed articles that we have put onto our website, and it can be sorted by the bleeding or clotting disorder, and you can click on a selection and it'll bring up the references in the articles. And if we don't have the complete article, then we have a link on where the physician can go and get the article to read about what they're interested in. And it's a really neat little interactive library that provides some significant information. And the other interesting point that I want to pick out on our website, other than under education and the webinars, is the Ask the Expert section, which a physician can go to, and they have to log in. They have to give us some information about where they are and who they are, but they can actually ask one of our physicians a question or concern that they may have concerning a patient. And when this happens, that question comes directly to someone on our staff, and we take that question and we turn it right around and triage it out to one of our physicians that we have either on our board of directors or on our medical advisory committee. And the foundation is dedicated to giving a 48-hour turnover of that information back to the physician. So I mean, it's not an emergent consult that a doctor would need in an emergency situation, but it is a discussion of the issue and some potential ideas and thought processes. And I thought, you know, this section is kind of really neat for doctors to, that if they do have a question that comes up with a patient, they can go and find the information within a couple of days, or get some answers, or see what the body of knowledge is out there. So I wanted to because we do consider our website state-of-the-art, and so that any physician can come to our website, get some information on bleeding and clotting disorders, and find the information they need so that they can change the life of their patient. Our state-of-the-art website, if we go back to our set of slides, offers basic medical information, as I said before, the references and abstracts and the Ask the Experts. The second part of our website offers our webinars, and these are done just like the webinar we're doing tonight, and we have one of our physicians or another faculty member that can provide the webinar. And we do it accredited, so the physician receives continuing medical education credits, and then we archive the webinar on our website so that if the physician was not able to attend the live webinar, they can come back, review the course, and if they review it within 1 year, they're still eligible to receive the CME accreditation. So those are two very exciting functions of our website that I thought I wanted to get out to the other patients and consumers that are out there, so that when they talk to their doctor, they say, well, if you have questions about this, or you can go to fwgbd.org and find out more information. And with this how, I know I've attended several conferences over the last couple of years, and people will come up to me and say, well, how can we help you as a patient, as a consumer? How can we talk to our doctors? And I think that's the exciting part of this discussion tonight, is that you can help us out, and there are things that you can do to talk to your provider. One more slide, please. Yeah, there we go. But you can talk to them about us as a resource, a web resource that's out there 24/7. You can provide them with basic information about us, and we also have cards. We call them flashcards, that are available that we could send to you. We could send you 1, we could send you 10, and you can take them to your physician and talk about going on to FWGBD and about your provider. And again, we're talking about not your normal hematologist provider, but your family practice provider, your pediatrician, your OBGYN, the doctors that don't see us a lot, or you may be their only patient that has a bleeding or clotting disorder, so they don't have a lot of information. So, and to let them know that they have a clinical connection through Ask the Experts. So I guess our major focus is just to promote the use of fwgbd.org. And if you would like to receive one of our flashcards or several, just give us a shout at info@fwgbd.org. Anne-Marie?
Thank you so much, Vicki. I'm just going to back up and reiterate these main features, which Vicki did such a wonderful job of taking us through as we displayed them. So here's that slide that I went quickly over. So Vicki could get to the things that you can do as a patient to help us in our mission to get the word out to providers, all healthcare providers. And now, I wanted to speak with you a little bit about the longer-term strategies that we have. As we were building the foundation, we thought from the beginning, well, these are good initial steps, all of these education strategies, the things we want to do now, the developing of our website, and each year we look at ways to enhance it and add more value to it. But longer term, we have things that we would like to see happen. We're talking about a medical and scientific journal devoted expressly to blood disorders, bleeding and clotting disorders in women and girls. We know now there are some incredible articles. We look at those and we look for those articles, the seminal articles that have steered the course of research and education in the area of women and girls' blood disorders and the clinical advances that we've been able to do. But we feel that now you're searching all over the place for this information. We do see down the road one composite journal that would capture all of the leading articles, have them all in one place. And it could be an e-journal, it doesn't have to be print as things are going in the world today, but we're looking down the road at a journal for women and girls' blood disorders. Something we want to do longer term, but not so far in the future. We've just had our 3rd anniversary, and the board has committed at a board staff. We did our first board staff retreat this month, actually early this month, and we've decided we're going to get moving on raising the money and funding training fellowships so that physicians and then also nurses can learn by shadowing an expert physician who already gets it about women and girls' bleeding disorders and other blood disorders. They can work with that mentor, and we will give them a training fellowship to do so and to get the education they need. We're very intent on having hematologists understand the reproductive life stage, the gynecologic and obstetric issues for women who have a bleeding disorder, and we think it's important that the OBGYNs get the hematologic issues. That's what we've seen in the best of the physicians who are working in this field with us now, like Andy James, Roshni Kulkarni, Barb Kunkel. They don't just get their own discipline, the OBGYN or the hematology, they get the intersection of the two. So we want to start teaching in that way, breaking down the silos that physicians learn and work in now, where it's just their one specialty, they don't look outside of it, and that leads to misdiagnosis and mismanagement. So we're going to break down those silos. We're going to raise money and fund these fellowships. We want to, down the road, we have been asked by our colleagues in other countries, when can we come and do this work with their providers, with their country? So we're looking at that as a longer-term strategy, that we would have a more global orientation, but we have a lot to do to build our strength in this country. We have a small committee looking at what the issues would be if we wanted to start some work internationally, but that's a longer-term strategy. And also something that you don't see on the slide, but we've been talking about with our board staff retreat, we have been approached by medical centers, teaching hospitals that want to now have a women and girls bleeding disorders clinic, and they've asked us, for our experts, to help guide them on establishing that clinic. We want to set up guidelines and a model for how those clinics can be established at an optimal level of care for our women and girls. So those are some of our longer-term strategies. The Foundation for Women and Girls with Blood Disorders, we're committed to working toward these, working hard on our current tactics and getting these longer-term strategies underway as well. Something we learn, and I think the older you get and the more you work in these areas, you know that no organization, no individual and no organization is an island unto itself getting the work done. We are very, very interested in partnerships, and in fact, more than interested in, we believe that's the only way to work effectively. And these are organizations, and you see prominently the HFA connection that we have, the partnership and collaboration that we've worked on by speaking, going to meetings, being a presence at the symposia annually, and by working on this talk tonight, by our other, collaborative endeavors where we're together at meetings and can influence how other organizations pay attention to these issues, your issues. That's the importance and the strength of partnership. And we're very, very grateful to HFA for the work we do together. You can see the Thrombosis and Hemostasis Summit. We're a founding organization for that with 7 others who initiated it, so certainly that's a partner for us. NASPAG, I talked about them earlier with what we did about the Anna DeSimone tribute, and that we are at their meeting. We'll be going again in April to their meeting when it's in Philadelphia. We think that the young, the physicians, they're not all young, some are older gynecologists, but they're serving the young population, the pediatric and adolescent women. So I think CDC you all know, and I think that gives a good view of the many partnerships. And we'll have more slides when we do this talk again for you in the future sometime, because we're always building these partnerships, only if they're meaningful and add value. This is just to say, again, our thanks to HFA, and we think that the work that HFA does with all of you as patients and family members is just incredible, and we can't do our work educating providers effectively if patients aren't being helped and supported and educated in an effective way, the way that Blood Sisterhood and the way that HFA does this. So we thank them very much. And we thank all of you. If there are questions now, Katie, Vicki and I are ready.
Okay, there are 2 questions, and the first one is about the presentation. If the attendees are able to obtain a copy of the slideshow. And I know if you would like to receive it directly from Foundation for Women and Girls with Blood Disorders, what was the website, the email address that they should?
You can just send an email to info@fwgbd.org and reference, that it was the webinar this evening, and we'll make sure we get the slide deck out to you.
Okay, and you can also send one to HFA programs at hemophiliafed.org, and we can send one to you as well. And then there's another question. Says, there is no hemophilia society in my area or other bleeding disorder society. I would love to help in presenting to the community the importance of understanding blood disorders in women and children. How can we get more involved in Central New York? There are actually 2 member orgs, one in Albany and one in Binghamton. But to become more involved, you can certainly, especially in Blood Sisterhood, you can certainly email me as the manager, k.verb@hemophiliafed.org. And then Anne-Marie and Vicki, do you guys have any pointers on getting more involved?
I think that getting involved with the organizations that focus on the patients is very, very important. And the way that we would like the involvement from you as a patient, a woman or girl with a blood disorder, we really need your help in the discussions that you can have with your providers. And if you could get the word out to your sisters in Blood Sisterhood and other members of HFA that they are effective, very effective, when they bring a message to a provider. And what we want you to bring to the provider, as Vicki was saying, is a tool. The tool is fwgbd.org. The tool is knowing that we are at medical society meetings We will be at the Medical Society meeting for that physician's discipline, so they can come to our symposia and our sessions, and they can address, as Vicki pointed out, they can address directly. If they have a question that's puzzling them about a situation they're grappling with in their office with their patients, they can address our experts directly through Ask the Expert. And we promise on that within 48 hours we will turn around and answer. Now that might not help in the next hour or instant, but 2-day turnaround is pretty good. So it's more, help us by being our voice in your physicians' offices and by letting other women and girls and the men in their lives know that they can tell physicians that same message and bring the tool of our foundation to their awareness and use.
Great. We don't have any more questions, but we had discussed opening it up for some discussion. So Michelle, did you want to open the lines? And if anybody had any questions that they want to ask directly and ask directly, that would be great.
Go ahead, Patrice. Call in and tell them about the chapter. Question.
Open for any questions.
Mm-hmm.
Katie?
Yes.
I have a question for you. If we want, I'm overseeing the women's program here in Houston.
Mm-hmm.
How can we go about getting someone from the foundation to come in and talk to our women's program about their program?
Someone from HFA or someone from the Foundation for Women and Girls with blood disorders?
Either or, either and or. I think if I need to get, if I'm going to have HFA, I can call Katie for it. But let's look specifically at the Foundation for Women and Girls.
Yes. Anne Marie or Vicki, I think, can speak to that. And absolutely, if you would like somebody, you can call me directly and see what we can work out.
Okay, that would be great, Katie. Thank you.
And Anne Marie and Vicki, do you?
Katie, can you please repeat the question? I'm sorry.
It was if they wanted to have someone from your foundation come down and talk to their women's group, how would they go about doing that?
Yes, they can. Well, you can email us directly or through info@fwgbd.org.
Okay.
Katie has our emails and contact info, so she can give you mine or Vicki's directly, or you can get us through info@fwgbd.org. And
Okay.
we'll be happy to arrange something. We have other staff too, and of course we have our advisors who might be able to do it depending on scheduling.
Okay. Katie, if I can get with you maybe tomorrow to get those direct emails, that would be great.
Okay. Yeah, absolutely.
Thank you.
When we opened the lines, I couldn't help but hear, I think there might be someone who wants to let us know about a chapter opportunity that is in New York that we perhaps didn't mention. Was that Patrice? I don't know. Did you hear that, or are they the only one?
I did hear that, but then I don't know. There's a couple more questions that have been submitted.
Okay.
In the text box, if you want me to read those.
Yes.
Let's see. Are you finding that a lot of physicians are calling in on the helpline?
That's very interesting. We have a good number, well, to us it's a good number because we started with nothing, but we get several each month. And I think what I need to say at this point, we're very impressed with the quality of the questions. The questions are important and they're things that need to be out there. And as we build, we are archiving most of the questions and answers already on the site, but as we build, we're looking at how we can get out some of that information even more broadly than just in our archive section of our website. So that's a very good question. We also have now looked at and discussed some new strategies for promoting. I think there's feedback because we have a lot of lines open, but I'll step back from my mic. We have some new strategies for getting the word out, and we ask all of you to help us do that because it's been incredible, some of the give and take that's gone on between our expert and a physician in the community who really needs the answer. So I hope I answered the question. We have several a month, maybe 7, 8 a month, and we want it to grow from that. But the quality and the depth and the importance of the questions are impressive to us. Is there another one, Katie?
I think that was a good answer. The other, I was just going to say, I was reading here, Melissa, we actually, the head of our advisory board, women by the name of Lou Wynn Collins, lives in Houston, and she said that she would be happy to help you guys as well, and she's local. So I can certainly put you guys in touch.
Actually, I think I have Lou's number.
Okay. Yeah, she just wrote me a note saying that she's happy to help you guys as well.
Great, thank you.
Did we surface that answer or question about the chapter in New York, or that didn't come up again?
The question is still out there because I'm the person who is looking for the chapter in New York. So if somebody knows of one in New York, that would be helpful.
I know that there is a chapter in Albany and a chapter in Binghamton. And then there are a few in actual New York City. I don't know, New York's fairly large. So do either of those areas help you?
What is your hometown?
I am in Jamesville, just about 10 miles south of Syracuse. So Binghamton's about an hour and a half away. Albany is about 2 hours away. New York City is too far.
Okay. Well, those, I'm looking right now at our map, and those are the closest that are to you.
And where are you vis-a-vis Rochester and Buffalo?
Rochester's an hour and a half. Buffalo is about 2.5 to 3 hours.
Oh, right. So there's still a
there's nothing in Syracuse at all.
Right. Well, I can empathize. I know in New Jersey, the association, the Hemophilia Association, is in East Brunswick, and there are, we have Cape May, so people have to go a good 2.5, sometimes 3 hours to navigate that. So yes, there isn't an ideal situation where chapters are everywhere for everyone. But that's, I guess, the challenge is then what can you and how can we help you, and importantly HFA, help you so you can have a group or a cluster, have what you need closer by, maybe in a small committee form or group form, or the Blood Sisterhood component.
And that's one thing that I think I'm looking for is a Blood Sisterhood, or even something where I can be helpful to the public in getting information out to doctors and to women and girls. One of the things that had happened to me, I'm now 54 and I wasn't diagnosed until I was 45, knowing my whole life that I had a bleeding disorder, but none of my doctors took the time to have me tested. And I don't want that to happen to anybody else.
That's, can we quote you? That's wonderful. I mean, it's sad. I don't mean it's wonderful that it happened to you, but it's, it crystallizes. It's the crux of why we're all doing this work. And you said it beautifully. So
exactly.
I think,
and oftentimes the chapters, like the two that Katie mentioned, might have educational sessions or networking sessions at different locations in the state. because I know here in Maine, the only chapter that we had was in Massachusetts, and everyone from the 6 New England states was a part of that chapter, and they would alternate where they had different functions. So you may want to check into both of the chapters and see if they do that.
And would the chapters be part of the FWGBD? Or
No, we're not a chapter organization. We don't have chapters. I mean, they might, you know, they know of us, or if they use our experts for education, but we don't have a chapter structure.
okay, so would they be under the National Hemophilia Foundation then?
They could be NHF, and they could be chapters of HFA as well. Right. Let me say one thing that I think you really have going for you. I'm sorry, what was your first name? I didn't hear it.
My name is Mary.
Mary. Okay. Oh, maybe you didn't give it. I didn't mean to force you to disclose it, but just the first name.
No,
Mary.
that's okay. Not a problem.
Thanks, Mary. I'm Anne Marie. So, Mary, I think chapters who get it, they love to hear that somebody like you wants to create a satellite, or wants to create some momentum and get a cluster of women and girls who are dealing with these issues in your area. There have to be some that are closer than 2.5 hours or an hour and a half away. So you could start being kind of the focal point or the center of getting those women who have the same need you do to talk to someone who's closer at hand than the 2.5 hour drive. So I have no idea, you know, how much time you have to devote to this, but if you're going to start asking that, they might come back and ask you, can you help us?
Okay, thank you. And just one last question. The webinars that are on your website, I know they're CME accredited. Are they also CEU accredited? I have an insurance license and have to take CEU courses for continuing education to keep my license up.
That's very interesting. Well, we're pretty new, 3 years, but we're starting. We have the CMEs, and Duke, unfortunately, unless they're changing it, they're looking at changing it. Duke is our partner for CMEs. They give CEUs for nurses, but only nurses who are in their own university. So now we have to look outside. Just even for CEUs for nursing, we have to go with a different organization. And you raised a very good point, and I thank you. We should look at other kinds of accreditation, because it's not just doctors and nurses and social workers who need it.
Okay, thank you.
Thank you.
Great. Are there any more questions? Or I'm looking, it looks like the questions that have been sent in have been answered. I'd just like to reiterate for those that are in Texas, Lou is a great resource, and she's happy to work with anyone. And if you guys don't have her information, I can certainly connect you with her. Also, feel free to email me for Blood Sisterhood questions. It's k.verb, V as in Victor, E-R, B as in baseball, at hemophiliafed.org. Again, I think I have another question that says, and we will be sending out, or if you would like a presentation, you can email. Anne-Marie, what was the email address again? You know what, after you tell me, I can type it in and send it to everybody.
Right. The general one is info@fwgbd.org. But we'll tell you where that goes. That goes directly to Vicki anyway. So that's a very good way of getting us, and it's not as cumbersome. I don't mind if you have my email. It's just easier than spelling my name out. But and Vicki's.
So they can email this email address for the presentation.
Right. And
yes.
Katie, you can feel free, if they ask you, please give my email, or Vicki, I think it's okay too if you give Vicki's. If they wanted to ask us something directly or get it from us directly. So Katie has all of that. Vicki, I'm sorry, were you going to say something?
No, I just agreed with you. That's all.
Oh, good. Well, I've really enjoyed the discussion and the opportunity to to speak with the HFA members and the Blood Sisterhood members this evening.
Yes, I did as well.
Yes,
Thank you very much.
Thank you guys all for all the attendees for coming, and we will let you know the next time we have a webinar. Hopefully we can get some discussions open and have these more frequently.
Thank y'all very much.
Yes, thank you for your questions. They were great.
Thank you.
Thank you.
Bye-bye.